Your pet has been diagnosed with diabetes mellitus. The good news is that the condition can be controlled with diet and medication, allowing your pet to lead a full and healthy life. The bad news is that you, as the owner, will be giving insulin injections and monitoring your pet's blood glucose as part of the treatment plan. Initially, these techniques can be intimidating and even frightening, but we hope this video will help make you feel more comfortable with them. To treat diabetes mellitus, you will need to give your pet insulin that must be injected. There are a variety of insulins that are effective in cats and dogs. Your veterinarian will prescribe the appropriate insulin for your pet. A great place to store insulin is in the refrigerator, but don't be concerned if you leave it out overnight. It is generally stable at room temperature. If the insulin is cloudy, it is a suspension and must be rolled gently to mix. If it is clear, it does not need to be mixed. Insulin comes in different concentrations. Make sure your insulin syringe matches your insulin concentration. The concentration will be printed on the insulin bottle. U100 insulin needs to be injected with U100 syringes. U40 insulin needs U40 syringes. Most veterinary insulins are U40 and need special syringes that you will get from your veterinarian. After the insulin is mixed, draw up the unit amount that you want to inject into the syringe. Tip the bottle up so that you don't get air into the syringe. Flick air bubbles out of the syringe. Pull up your pet's skin to make a tent and insert the needle through the skin. Inject the insulin and then withdraw the syringe to pull out the needle. Do not recap the needle and discard the whole syringe in a sharps container or plastic bottle. Some insulins come in preloaded pens, so you do not have to measure the amount in a syringe. There are special insulin pens for dogs and cats. The insulin pens come in different sizes, and one will be dispensed to you depending on the dose of insulin your pet requires. The dial at the end of the pen is labeled to represent the number of insulin units that will be injected. Turn the dial until you reach the appropriate insulin dose prescribed for your pet. Open the disposable needle and attach it to the tip of the pen. Remove the cap and needle shield, and you are ready to inject the insulin. Pull up your pet's skin to make a tent and insert the needle through the skin. Inject the insulin and then withdraw the syringe to pull out the needle. Do not recap the needle and discard in a sharps container or plastic bottle. You should vary injection sites around your pet's body. Try to make the injection experience a good one by feeding or playing with your pet right after the injection is given. To see how well the insulin is working, you will measure blood glucose on a portable glucometer. Many pet owners prefer using a special veterinary glucometer called the AlphaTrack. This device can measure blood glucose in a tiny amount of blood. The strips have different calibrations for cats and dogs. The number on the strip should match the number on the meter. To check the blood glucose, get all the supplies ready. Gather the glucometer, glucometer strips, logbook to record blood glucose measurements, and the lancet. Place the strip into the glucometer, which should then turn it on. For dogs, the best places to get the blood are the pinna of the ear or the gums. If using the ear flap, first get the dog in a comfortable position so that he or she and you are relaxed. Rub the area between your fingers for a few seconds to get good blood flow. Press the lancet directly against the skin to cause the spring-activated device to make a small cut. Remove the lancet and allow a nice blood bubble to form. Place the glucometer strip into the blood bubble until you hear a beep signaling that sufficient blood has been taken onto the strip for a reading. The blood glucose reading should appear in a few seconds on the glucometer. Record this value. Sometimes the blood will flow slowly, so be patient and allow time for the bubble to form. To use the dog's inner lip, put the dog in a comfortable position. Lift the lip and place the lancet directly and firmly on the inside surface. The spring-activated device will make a small cut. Wait for the blood bubble to form and put the sampling end of the glucometer strip onto it. Wait for the beep to tell you there is sufficient sample. Record the glucometer reading. Alternative sites to get blood samples in the dog are the elbow, or foot pad. To treat your diabetic cat, you will need to give insulin by injection as in the dog. Prepare the insulin dose as described earlier in this video. Some nervous cats may be more comfortable being wrapped in a towel. Pull up your pet's skin to make a tent and insert the needle through the skin. Inject the insulin and then withdraw the syringe to pull out the needle. Do not recap the needle and discard the whole syringe in a sharps container or plastic bottle. For cats, the best place to obtain blood for the glucose measurement is the inside of the ear. Place the cat in a comfortable position, perhaps on your lap or on a table. Gather your supplies, including the glucometer, glucose strip, and lancet. Place the glucose strip into the glucometer. The glucometer will automatically turn on. Pet your cat to calm him or her and rub the ear between your thumb and forefinger to stimulate blood flow. Place the lancet directly and firmly against the skin. This will activate the spring-loaded device to make a small cut. Wait for a good blood bubble to form and place the sampling edge of the glucose strip onto the bubble. A beep will signal when enough blood is on the strip. Wait a few seconds for the blood glucose reading to occur and record the value. Tell your cat what a great job he or she did and give some extra loving so that he or she will think of the blood draw as a good experience. We hope you feel more comfortable managing your pet's diabetes mellitus. You should contact your veterinarian with any questions you may have. Your veterinary team is always available to help in any way.